Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide this week's update on the COVID-19 pandemic around the world and in our country. As we've said many times, the pandemic has been exploding around the world. This is the weekly numbers of confirmed deaths. And this week we're over 750,000, over 750,000 deaths, and almost 22 million confirmed cases worldwide. We know this is a tremendous underestimate because there are so many countries that don't test or can't test and don't have good reporting mechanisms. It's been a 5.4% increase in the past week alone and a 27% increase in number of deaths in the last month. As I've pointed out before, there are some countries like Belgium, which is the most heavily impacted country in Europe, which has seen essentially a very small increase in their number of deaths over the past couple of months, what we would call a mature epidemic. If you flip this over and look at the week-to-week percentage growth rate, early on they were over 100%. They were doubling their number of deaths every week, and it has come down, and then for several months has stayed very, very low. They're still getting more deaths, but nothing like the growth rate that they saw in the beginning. Unfortunately, worldwide, we're not seeing that yet. We're still seeing an increase in the total number of deaths. And if you look at the week-to-week percentages, again, it was very high to begin with. It's been coming down, but it's been leveling off between 5 and 10%. The way to think about this is that there are multiple epidemics evolving in different countries around the world, each with a different pattern. So just to show what I've shown before, there's Belgium, there's the United States, which is slowing down, but not as quickly as Belgium. There's Brazil, which is growing consistently, and then countries like South Africa that are growing quite quickly. I'm not picking on those 4 countries. They just give you a sense of how the pandemic is evolving in different places. This cut and paste from Worldometer shows that week after week, we've seen a slow increase in the number of countries and the amount of cases. Now, this is cases, so it's a little misleading because obviously more populous countries will have more cases, but you get a sense of the evolution of the pandemic with this. Again, about 6 weeks ago, we listed the top 25 countries in the world in terms of deaths per million, which is a good measure of how impacted a country is. We color-coded. Dark blue is North America, pink is South America, and yellow is other. And then this week, we've done the same thing. And again, color-coded it. And then if you put them side by side, what you can see is that Belgium is still the most heavily impacted country in the world, having grown about 1% in the past 6 weeks. But compare that, for example, to a country like Peru, which has more than doubled and is now the second most impacted country in the world. And you can look at all the South American countries and see how they've grown. The United States is about where it was in terms of global ranking, but has increased considerably in that last 6 weeks. And then you can see at the bottom that 6 weeks ago, it took 77 deaths per million to be in the top 25. That's almost tripled. So you get 2 senses. One, that the number of deaths is growing worldwide, and that it's evolving into different parts of the world at different times. And this is also true of the United States. Again, we saw this explosive growth in the number of deaths, such that we now have over 175,000 deaths and 5.5 million confirmed cases, a 4.6% increase in the past week. And again, as I say every single time, we have to remember that in 6 months, we would normally expect this many deaths from the top 10 causes of death, and yet we saw 130,000 deaths from COVID-19 that would place it about third. If you look at cases, we had this explosive rise early on, then it dropped and it came back. This is not a second wave that some people talked about. This was just as we reopened and as the pandemic spread into different parts of the country. We see a similar pattern with daily deaths. It drops and has now appeared to be coming back up a little bit. If you look at the week-to-week change, again, we'd like to see this coming down to 0. Instead, we see it leveling off about 4.5% to 5%. That's a significant growth rate because that means we're continuing to see 4 to 5% more deaths every week than we saw the week before. We see the same pattern with hospitalizations, again, leveling off. And again, what this means is that the pandemic, the epidemic in our country is spreading into different places. And again, we see this pattern, we see different patterns. You see New York, which looks a lot like the rest of the United States, Tennessee, which is growing, and then Florida, which is growing even more quickly. If you look at all, this is a map of where the cases have been. And then I'm superimposing on top of that where the cases are in the last 2 weeks. And what you can see is that we're starting to see a spread from the large urban areas where they were, this is total cases, into more rural areas. And you can look at Tennessee, and I'll show you detail on that later. But we clearly are seeing an evolving pandemic impacting different parts of the world and different parts of our country. There's a lot more information about COVID-19 on our website, or if you'd like to be added to the mailing list. Several of you tell me that you share these videos with others, and I appreciate that. But if you'd like them to be added or you to be added, please contact Jan Stork at this email or that phone number. And obviously, if you have any questions or any issues you'd like me to cover, please let me know. I look forward to trying to find an answer. Thank you very much.